Very good evening, everybody. Meeting again in the session of philosophy, and we're discussing regarding the Stuart Close philosophy, the chapter number 9, Cure and Recovery, and we were on page number 131. Yesterday, we have discussed only one paragraph because it is the important point in the requirements of the cure. He has tried to explain that in order to achieve a cure, there are certain requirements. The first requirement he has explained that if you are applying any homeopathic medicine, it should be according to the cardinal principles. That is the first requirement. Second requirement which he has mentioned over there is approach should be individual. There is no group practice in homeopathy. So 10 patients of the typhoid are there, your 10 remedies are different according to each and every individual, and you have to go on treating individual case. And third important requirement, which he has explained while explaining the examination of the patient and construction of the case, he explained that detailed thorough case taking is necessary. And we have spent nearly about 2 lectures on that point. Because all those points which he has explained over there in order to understand the human being are rather very important. There is necessary of understanding what is the past history of the patient, the family history of the patient, which guides you to find it out exact miasm. And then the patient's raising and evolution and education, all things are necessary in order to understand the present state of his miasm. And thereafter, he has explained over there that the patient's education, the occupation, his habits, his social and domestic relationships, all are you have to take into consideration, because many of the time, in fact, many times the causes, the dynamic causes are hidden in this part. You have to understand all those points. And later on, one more important point which he has highlighted, a chronological symptomatic history of his disease. So how the disease has started right from the start. If it is there right from the childhood, you must understand it right from the childhood till today, how it has developed. What was there in the childhood, then later when he becomes little bit elder, then at the adolescence, at the adult, what is the evolution of his disease, whether it has cured or whether it is just palliated every time, or whether the present disease is the because of separation in the past. All things you have to take into consideration, and that's why chronology is very important regarding it. And then few important points. You have to look towards the indispositions in his history, idiosyncrasies, the accidents, and last word which we have discussed, that vicissitudes, means unpleasant experiences in his lifetime. Those we have discussed in detail in last lecture. Let us go with the next paragraph of this chapter on the page number 131. In considering the recorded results of each examination, the homeopathic therapist pays particular attention to the unusual, peculiar, exceptional features or symptoms which give the case its individuality. For by these, under the guidance of principle of symptom similarity, he is led to the remedy needed for the cure of the individual case. So what is important from your point of view is the very peculiar characteristic symptom. Characteristic symptoms, the definition is there, the symptoms which characterizes an individual are called as characteristic symptoms. They are of 4 types: the peculiar, the queer, the rare, the strange, and or striking. And all those are very important in order to understand exactly the nature of that individual, which guides you directly towards the remedy. If such types of symptoms are there in your case taking, your work is done, half done, in fact, because it becomes simple to reach to the remedy. For example, patient who comes to you with very specific eczema, and his eczema, there is a tremendous itching followed by burning, and it is that burning is better by warm application. This is the peculiarity. This is peculiar to only one remedy. It is the characteristic of arsenic album. You are coming to directly to the remedy on the basis of that. So, to find it out exact nature or exact remedy, in your case, you must get the characteristic symptoms, and characteristic symptoms are well guiding symptoms to reach to the right remedy. One patient comes to you. Just now there was a patient who had eczematous pattern on the body, and there was very important, there were thick crusts over there. Under that thick crust, there was a pus underneath. If you just touch that scab, the pus was oozing from outside. So what it indicates? It is the characteristic of one remedy with which you can catch, yes, this is the so and so remedy. If you are able to catch such types of characteristic symptoms in your case, then your work becomes very simple. So what is the remedy? Anyone knows?
Vinca minor, sir?
No. Vinca minor specifically, it happens more on the scalp. Yes, Archana madam, she has told mesarium, very correct. The eruptions where the thick crusts are there under which the pus is collected, that is a very typical symptom of mesarium. Such types of characteristic symptoms, if you are getting, then your work is done. And that's what he is explaining, that your totality should have the characteristic symptom. Symptoms, general or and particular, behave themselves in a particular way, take on peculiar forms, combinations and modalities according to the morphological type, environment, personality and predisposition of the individual. So whether the patient's symptom is a general symptom or a particular symptom which carries its own characteristic of the individual, every individual presents it in a different manner. There is one patient who came to me and he is having, doctor, I am having very severe pain over here. Since so many days I am having this, it has been said that I have the sinusitis, they have given me the medicine, the antibiotic course and everything. I have done antibiotic course at least 8 to 10 times. Temporarily I feels better, but it never goes. It is persistent, and that's why I want your help. And he comes and he says, there is a pain over here. He is explaining you something which is very essential to catch. So you have to give him a remedy. Nothing else in the case, but this is very typical that he is having that typical headache, and there is a heaviness. The diagnosis is also known. It is a sinusitis. So what remedy you are going to prescribe? Any specific remedy?
Chylomicromicum?
Yes, Chylomicromicum. Very correct. Why? Because of two reasons.
Pain in the spot.
Pain in
at
spots
glabella.
along with pain at the glabella. It is glabellar headache, which is there in the Chylomicromicum. And Chylomicromicum is the syphilitic remedy where the bony pain is there inside the bones. So you get all three characteristics with simple thing. Only thing is that what you have to perceive. You have to catch that. Then it is possible to get right remedy. And every patient has its own morphology expressing in his own symptoms. If a patient comes to you with a diagnosis of a malaria, and he is having very clearly the chill at 4 a.m. Why he is getting chill at 4 a.m.? Only reason is that his constitution is different. It carries his own characteristic over there in the time modality. And he says, doctor, at 4 o'clock, I got very severe chill. That's all. He's giving you exactly the remedy. Whether the diagnosis is malaria, whether the diagnosis is dengue, it doesn't matter for you. But he is giving you something, individuality. And that is the morphology expressing through his time modality over there. So what is the remedy which you are going to prescribe? In the Kent's Mathematical, single remedy.
Calicat.
No, chill at 4 a.m.
Cetron.
It is Cedron, correct, very correct. It is Cedron, chill at 4 a.m. Only one remedy in the Kent's mud remedy. And Cedron has that typical intermittent type of pill. So how you reach to the remedy? Not on the diagnosis. You reach to the remedy on the basis of that morphological type, that specific entity which was characteristic enough to find it out the individuality of that individual. And this is what he is expressing over there, that you must know the modalities, you must get the morphological type, even sometimes the environment is also plays the role. What is the environment? Now it is changing. What is the present environment? Present environment is very typical. It is changing now. 3 days, 4 days
Hot days
back
and
there.
cold nights.
Hmm?
Hot days and cold nights now
Correct,
start.
very correct. 4 days back, it was completely cold. Now I am sitting over here putting on AC. Days are hot, nights are cold, with a dryness of the leaves. It is not Dalkamara, madam. It is Bryonia.
Bryonia.
It is Bryonia. Dalkamara is at the end of rainy season. When rainy season changes to that specific cold weather, or sometimes if hot weather is changing towards the rainy, then it becomes a Dalkamara. At present, it is turning towards the Bryonia. So environment is also important, where you can catch the remedy. So environment. Then third thing he is explaining the personality. Everyone's personality is different. Upper half of the body is weak and lower half of the body is big. I know everyone knows the remedy, but I will not going to ask that remedy. I will ask exactly opposite. Upper half of the body is big, lower half of the body is weak. Now tell me the remedy.
Ammonium mur.
Correct, very
Ammonium.
correct. It is ammonium muriaticum. Very correct. Very correct. It is ammonium muriaticum. Exactly opposite to the lycopodium. So this personality also guides you towards the remedy. If there is a tremendous greasy face, then you must open the repertory, find it out, face greasy, you get the remedies, and you are coming to that. On the basis of personality, you are coming to the group of remedy. Another patient who comes to you with what at the tip of the nose, and that is looking odd, but that is the characteristic. He is having very specifically what at the tip of the nose. The remedy is
Causticum.
correct, very correct. It is causticum, having the what's at the tip of the nose. So you get that on the individuality. That is what is the individuality. And last word which he has explained is predisposition of the individual. The predisposition word means miasm. Predisposition means it is miasm. It is carried from past generation, predisposition. So everyone's miasm is different and everyone's present miasm is different. So don't consider your remedy only on the past history. You have to understand the whole evolution. Then you catch exactly, yes, what is the present miasm. So detailed history, personal history is needed, and evolution is also needed when you have to understand the patient. Then he further says, it is necessary thus to study the individual in order to understand how a general and or particular predispositions to disease becomes concrete and the object of treatment and cure, as well as to elicit symptoms which are to guide in the selection of remedy. If you overlook towards the predispositions, simple thing. There was one question, one of the teacher who argued with me, sir, what is the use of considering miasms and everything? Better patient tells us the symptom, we give the remedy, that's all. That is what is the homeopathy. Why it is necessary to consider the miasm? He was arguing with me. When I explained the things, he said that I don't know that we used to prescribe only on symptoms. I said, because of which you get the palliative result. I will tell you simple example. Patient who was suffering from severe headache since last 3-4 years. He said 4 years back, I used to suffer from headache. It has started 4 years back. I used to get a one-sided headache. It used to get aggravated whenever I used to go to the sun. It is, I could not look toward the light. Light aggravates. It's throbbing, very much throbbing. I could not tolerate the light. I could not tolerate the noise, everything. And his face used to find it out, the redness over there, congestion over there. Earlier, it used to happen every monthly. After a year, it has started suffering me around once in a week. In last 6 months, the frequency is so increased that it has been nearly about every alternate days it was happening. And since last 1 month, it is daily. I could not tolerate it. This he has explained. He has shown that when this disease has started 3 years back, it was so severe. So I have done this MRI. MRI is normal. Nothing is there. So what's your remedy?
Glonine, sir.
Glonine. Okay. Why?
Because according with suns and throbbing sensation.
Okay. Any other remedy which comes in your mind?
Belladonna or like
Belladonna. Yes. This is what happens with us. We are not taking into consideration that this is happening since last 3 years. It is our duty to ask him to go for investigation again go for the MRI scan. And if you ask him to go for MRI, repeat MRI, and now there is some lesion in the brain. If this is so, then you have to take into consideration the remedy which has capacity to clear that lesion inside the brain. That depth should be there, that predisposition, the miasm which indicates over here in psychotubercular. Here, your remedy should have that depth. Belladonna doesn't have that depth. Glonine is 1 day action. Belladonna 1 to 7 days action. Patient's problem is there since last 3 years. Unless and until you take into consideration the miasmatic focus, it is not possible to reach right remedy. Prerna has very clearly explained, yes, Netramur probably, yes, sure. Netramur has that much depth. So your remedy is dependent upon what predisposition is there, what miasm is there. That's the importance of miasm. Without which you cannot get a right remedy. And this is what he is explaining, that if you want to achieve the cure, you must know all those details very clearly. And this is what is the requirement for the cure. So to conclude that paragraph, what he says, it is necessary thus to study the individual work in individual in order to understand how a general or particular predisposition to disease becomes concrete and object of treatment or cure, as well as elicit symptoms which are to guide in the selection of the remedy. So these are three important things, requirements which he has mentioned in order to achieve cure. First requirement is that whatever remedy which you are selecting, it should be according to the cardinal principles of homeopathy. Second important criteria which he has explained over there is that whenever you are prescribing that medicine, it should be individualistic. And third important criteria which he has explained, that in order to get a right remedy, you must require the detailed case taking, detailed history. Then you can reach to the right remedy. So these are things which he has explained. Now he is turning towards another point, manner and direction of cure. We'll finish that topic today and then we'll stop. Manner and direction of the cure. Cures takes place in a definite orderly manner and direction. Normal vital processes, cellular, organic or systemic, begins at the center and proceed outwardly. Figuratively, if not literally, life is the centrifugal force. Life is the centrifugal force radiating, externalizing, concentrating, and organizing spirit into the matter from above downward. In the same sense, disease is a centripetal force opposing, obstructing, penetrating towards the center and tending to disorganize. The progression of all chronic diseases from the surface toward the center and from less important organ to the vital organs from below upwards. Now he is explaining exactly how the disease develops, how the human develops. How is the human development? There is a law of biological development. I have told you that law. Anyone knows what is the law of biological development? It is only 3 words. Law of biological development is functions creates
Function
organs.
creates.
That is simple. Functions creates the organs. It means the functions are defined. There is a fertilized egg, which is of single cell. Cells are not specialized. There is single cell which starts dividing and first functions are defined. Who defines the function? Who gives the function? Once the vital force enters over there, that vital principle which defines, yes, these are the functions you have to carry out, and then cells start dividing and function is defined. For one cell, it has been said, you do the work of head, do the work of brain. Another cell, it has been told that you do the work of eyes, the third cell, the nose, the third, fourth cell, mouth, and then same cell changes into the another things. Means functions are defined and then accordingly the cells changes their structure. And that's why functions creates the organ. This is the law, which is called as law of biological development. It indicates human development is from center to periphery. It starts at the single cell and it gradually goes on developing different organs. So when human development is from center to periphery, he maintains his health right from center to periphery. It develops from above downwards. All those things are there. Whenever disease has to happen, disease affects the center, but it starts expressing at the periphery. It affects the center, the vital force, the vital principle, and it expresses externally in the form of some skin lesion, most commonly the skin manifestations. They are there on the peripheral layer. And what do? You apply something externally. And now disease goes in the reverse order, in the order from periphery to the center. It affects more internal organ. Then again something is suppressed. Again it goes towards more center. If this is the direction of a disease, one has to understand what is the direction, what should be the direction of cure. One must think the direction of cure. That's why Herring has explained very clearly the law of direction of cure, and which is called to be Herring's law of direction of cure. The cure must take place from above downwards, from center to periphery, from the organs of greater importance to the organs of lesser importance, from above, from the in the reverse order of appearance of the symptoms. This is why he has explained, why he has made that, in order to understand whether we are on right path or wrong path. When we prescribe remedy, in which direction we are going. Whether our remedy is right or wrong, that one must know. And that's why, to understand this, he has explained that manner and direction of cure is very much necessary to understand. Further, he says, curative medicines reinforce the life force, reverse the morbid process, and annihilate the disease. Symptoms disappears from above downward, from within outward, and in the reverse order of their appearance. When a patient with an obscure rheumatic endocarditis, for example, begins to have signs and symptoms of acute arthritis soon after taking homeopathic remedy and is relieved of his chest sufferings, we know that cure has commenced. So patient is there who is having rheumatic heart disease, and you know the chronology. Patient has started First, some skin symptoms, those are suppressed. Then he started getting the rheumatism. And then rheumatism is again suppressed with painkillers. And now it has turned toward the heart, producing rheumatic heart disease. You know the remedies, rheumatic heart disease remedies, at least two one must know. Which are two important remedies? If the patient says that, doctor, this has started when I started getting the pain in shoulder, then my elbows are affected, then my wrists are affected, then my hips are affected, then my knees are affected, and now I have the ankle pain. Why cardamom? Patient has explained this. Very typical. Two remedies, very important. I have told you exactly how this has started. It has first started with the shoulders, then elbows, then the wrist, then the hips, then the knees, then the ankles.
Calmia, sir.
Correct. It is calmia latiafolia, rheumatic heart disease. It is calmia. It is going in descending direction and which has rheumatic heart disease directly. So, if you have started treating with calmia and patient's heart complaint, the breathlessness, everything stopped and he feels better, no more palpitation, nothing, he can run and his joint pains little bit increased. It means you are going in right direction because you know that it is going from greater importance, organ of greater importance to the organ of lesser importance. It is turning in right direction. And for that purpose, he has mentioned that this direction is important. And to conclude that paragraph, he says cure takes place in much less time than natural recovery without pain, physiological disturbance, or danger from the use of remedy employed and without sequelae. The restoration of health is complete and lasting. If the law of direction of cure is followed properly, and if it is happening after giving a right remedy, it means patient will be cured completely and reach to the state of health. So today we have finished some few aspects about the cure. Few more are remaining. Tomorrow we might conclude this chapter, maybe or may not be, I don't know. Because this is practical part and which we have to learn in this way. So are you getting what I am telling or what I am teaching? I don't know your response. So is it going in right direction or something? It is going in fast. What do you feel?
So now we are getting confidence in our practice, sir, after listening to your lectures and everything.
Thank you. Thank you. Thanks a lot. So I expect that you must ask your friends to join this session because philosophy is more important than even materia medica and repertory. Philosophy, if you understand philosophy properly, you can practice very nicely. Ask your friends to join the session. Okay. Thank you.
Sir,
We'll
one
meet
thing.
at 8 o'clock with new remedy. Remedy.
Sir, 1 minute.
Yes.
Sir, headache, what you have given one example of that headache, natramur was given. Actually, for acute case, we have to, when he comes and he says that there is throbbing, and according to symptoms, we have to give either belladonna or glonine. Later on, we have to go for natramur.
First important thing, keep it in your mind always that whether the patient complaint is acute or chronic. If patient is in acute state, yes, you can palliate that with the help of belladonna or glonine, but that will not cure the palliation happens, maybe palliate, may get palliation. But natramur has the same symptoms. Natramur have same type of symptoms. If you
But
give
it
the
takes
right,
time. But it takes some time.
no,
Natramur will not.
natramur, if you give in LM in repeated doses, it can work in the similar manner. And LM is better scale for such types of cases.
Okay. Then in case of menorrhagia and in that type of cases, suppose if a lady is having menorrhagia in every period, and now she is of 22. From menarche it has started and now she is 22 or 23. Then shall we give acute remedy or go with some miasma?
Basically chronic. If it is persistent, long-standing, then you have to think about remedy which covers the miasm, and you must know What may be the cause behind it? Whether it is turning towards any pathology, that also you have to catch. So you have to
Okay,
find
sir.
it out with exactly what is the why she is having so much of continuous menorrhagia.
Okay, sir.
Okay. So thank you being there. We'll meet again at 8 o'clock with orometallic.